Hi, this is Dr. Dean Kelaita, Calaveras County Health Officer, with a quick update on the current COVID-19 situation affecting Calaveras County, and then address the specifics regarding the amended local public health officer order to allow for expanded outside physical activities. Most recent update regarding statistics on COVID-19. California now has 42,164 cases and 1,700 deaths. Almost 5,000 cases have been reported in California healthcare workers. Calaveras County has 13 confirmed cases, with one additional case reported in the past week and a household contact to a previous case residing in the West Point community. No COVID-19 deaths have been reported in Calaveras County residents to date. A total of almost 400 tests have been performed already on Calaveras County residents, with the 13 positive results as I discussed. The local hospital and medical care system have sufficient capacity to care for patients at this time, including adequate personal protective equipment, PPE, supplies, hospital and ICU beds, and ventilators to support critically ill patients with impaired breathing from COVID-19 infection. Calaveras has one licensed skilled nursing facility, a nursing home, Avalon San Andreas. So far, no COVID-19 cases have been reported in this high-risk population of 100 residents and 200 staff. Monday, the Turlock Nursing and Rehabilitation Center experienced an outbreak with 51 cases and 2 deaths. We're continuing our containment activities and increasing the testing program to protect these vulnerable members of our community and prevent a similar situation here in our area. The alternative care site at Calaveras High School has had equipment deployed and is being set up to support an additional 30 beds and can be staffed by the State Medical Corps in a relatively short time frame if needed. Additionally, Calaveras County, as part of the Region 4 Emergency Medical System area, will have access to the Sleep Train Arena alternate care site. This is a state-run 400-bed medical site to care for a regional surge of COVID-19 patients if necessary. Testing and contact tracing. Calaveras Public Health has been working in collaboration with Mark Twain Medical Center to increase testing capability to approximately 500 test kits currently available. Revised testing guidelines have been issued to the hospital and local outpatient medical providers that expands the criteria for those recommended for COVID-19 testing. Testing statewide is being prioritized and increasing from 16,000 per day last week to 25,000 daily by April 30th, and to reach 60,000 to 80,000 a day in the weeks thereafter. As part of this effort, California has partnered with Google's sister company, Verily Life Sciences and OptumServe, to open 86 new testing sites around the state, with a focus on filling testing deserts in rural areas. Additionally, the state is working with local health departments to build up an army of contact tracers, some 10,000 strong, to work with local jurisdictions to interview infected patients and contact those that they may have been exposed to for quarantine recommendations to keep them from infecting others. As I discussed last week, due to a decreased rate of confirmed case counts and disease occurrence, California is striving to reach a point where we can relax the stay-at-home rules that we're under to contain the outbreak. Enhanced testing and contact tracing are now the most critical components needed to be able to relax the statewide shelter-in-place orders. the status of the current stay-at-home directives I'd like to talk about now. So let's discuss the status of our state and local Calaveras stay-at-home public health orders and what we can do to modify some of the current restrictions. I want to start off by reminding everyone that Calaveras residents are subject to the governor's stay-at-home executive order. This establishes the directive to stay at home, defines essential versus non-essential businesses and activities, and details the exact types of allowed and non-allowed activities which we are to engage in. California took early and aggressive steps to contain the outbreak, which has helped to keep overall cases and fatalities low. It's no accident Calaveras County has not been hit hard. What can we do now to start our community on the path to reopening? A first step in that direction was announced Wednesday and consists of allowing the healthcare system to resume certain procedures that have been put on hold, like cancer treatment, elective surgeries, and testing such as colonoscopies and other cancer screening tests. Additionally, the state executive order allows for individual and household outdoor pursuits for exercise and physical activity. Today, I'm issuing an amended public health officer order to provide clarification for enhanced outdoor physical activities in our community to proceed, such as hiking, jogging, hunting, fishing, boating, golf, ATV, and equestrian trail usage, as long as they're undertaken with the adherence to strict social distancing practices and maintain at least 6 feet between participants. Residents may use outdoor parks and green spaces, but children's playground structures and equipment will remain off limits. Vehicle parking in parking lots designated for outdoor activity venues, such as boat docks, golf courses, and trailheads, will be allowed, with the exception that the users will not congregate and maintain social distance of at least 6 feet while assessing and accessing and entering and exiting their vehicles. This amended public health order does not change the designation of what the state defines as essential and non-essential activities and businesses. Very few of the currently closed businesses will be affected by this order. For example, residents may access lakes and waterways with their personal motorized or non-motorized watercraft, but commercial rentals of such equipment remains a non-essential business activity and as such is not allowed under the state mandate. Whenever individuals are outside of their home, whether engaged in a physical outdoor exercise activity or going to the grocery store, they are recommended to wear a facial covering over the nose and mouth. The full amended public health order will be available online on the Calaveras Public Health Services website for review. According to the California governor, Monday, the state is just weeks away, not months away, from meaningful modifications to the statewide closure order. As the statewide stay-at-home order is amended and relaxed, I'm committed to following right along, assuming the facts regarding COVID-19 disease activity in Calaveras allows for it. Through the community mitigation efforts and sacrifices of all of our residents over the past 6 weeks, we have successfully flattened the curve, protected our senior residents in our nursing home and assisted living facilities, supported our healthcare workers and frontline medical care workers, and saved lives. But the coronavirus is not through with us yet. I want to see our economy opened up. I agree that things should be reopened, but it should be opened deliberately, bit by bit, and informed by science and medicine. The last thing any of us wants to see is a resurgence of disease activity and an undoing of everything we've built to protect the health of our community. I thank you for your support, and this will be a process that we go through to get things reopened back in our community. But so far we've been doing well with COVID-19 disease. We have not overwhelmed the medical care system. We've protected the health of our seniors, and further information will be coming forward as we develop it in the next few weeks. Thank you.